Diolch, Dipper. Thank you for your statement, Cabinet Secretary. I would also like to place on record my thanks to Dr Ruth Hussey and the panel for keeping me and my team regularly updated on the review's progress. The interim report starkly lays out the challenges facing health and social care in Wales. We are at an evolutionary moment with our health and care systems. We adapt or we perish. This is not a problem that can be solved by simply throwing money at it. As Dr Hussey correctly identifies, we have to make urgent systemic changes to the way we deliver care. We have to work smarter. We have to spend smarter. Cabinet Secretary, I welcome this interim report and the findings set out by Dr Hussey and her team. We now have a much clearer view of the challenge facing us as a nation and the challenge facing us as politicians. I'm convinced that we have to change the way we deliver health and social care in the future. It is now up to us here in this chamber to convince the public of the need for change and to engage with them in designing our future health and care system. Cabinet Secretary, how do you plan to encourage as many members of the public as possible to engage with the parliamentary review? The panel suggests a new number of models of care could be trialled and evaluated. Cabinet Secretary, if you can answer at this stage, how long will the trials run and how do you plan to run such trials concurrently? Whichever new models of care we adopt, they will all rely on new technology and shared data. Cabinet Secretary, can you outline the steps, the steps your government is taking to improve NWIS to ensure it can adapt to future needs? However care is delivered, we need a workforce to deliver it. We need to encourage more young people to become doctors, nurses, physios, occupational therapists and pharmacists. We also need experts in machine learning and big data, computer network specialists and programmers. Cabinet Secretary, what is the Welsh Government doing to encourage more young people to study STEM subjects to ensure we have the workforce we need in future? It is vital we deliver the necessary changes as quickly as possible if we are to ensure future generations we will have a health and social care system that meets their needs. Regarding our infrastructure, as has previously been mentioned, if people are to be encouraged to stay in their homes, we must make sure that with an ageing population, that new housing is built to recognise the changing needs in building regulations to accommodate disabled needs. Our infrastructure regarding public transport is in future also going to have to change. I look forward to working with the Parliamentary review over the coming months to receiving the final report and working with you, Cabinet Secretary, to deliver the recommendations made by Dr Hussey and the panel. Diolch yn fawr. Thank you.
Thank you. Cabinet Secretary.
Thank you for the comments and questions. I'll do this in reverse order. Again, I've recognised the points about housing, but again, you make a point about transport and transport needs both to specialists in hospital centres, but also physical access to local care as well, and how that will be delivered, how much will be delivered in centres that people travel to, and how much will be in someone's home. And that is intrinsically also linked to the way in which we deliver telehealth and make that much more accessible and commonplace. We already have good examples of that, and again, this is about the comments that Rhian ap Iorwerth made earlier, things we could do now, and actually delivering a more demanding but evidence-led approach on telehealth is one of the things I think we could do, and I'd be surprised if that doesn't form part of the final discussion in the report and recommendations. On your point then about education and encouraging people to study different subjects, well, of course, that is a cross-government perspective. Not just the pre-16 curriculum in the early years, which both Alan Davis and Kirsty Williams have a direct interest in, about how we equip and encourage people and our childcraft, what that does to improve people's attainment and their aspirations for the future, all the way through school education and beyond, where actually people then make different choices about what they want to do. There is something, again, about the curriculum for healthcare professionals, and they undertake their own training. If we want people to work in a different way as part of a multidisciplinary team, they need to be trained to work in that way whilst undertaking their qualifications too. So I recognise the points there that are being made. And on the NWIS, or the National Wales Informatics Service, there is a challenge there that's set out in the report about how they adapt to future needs, and it's more than just the points were made by both Angela Burns and Rena Yodworth. It is also about the ability to actually think about how we actually gear that up. Not just about delivering once for Wales methods and make sure health boards and trusts buy into that, but actually how it actually manages to maintain the work that is already done, because the report recognises that much of what NWIS does is maintaining what already exists. And the space for it to develop and deliver new systems is not always easy. The ability and, if you like, the capacity and the power to do that. And it poses some questions in the report about how it's going to be done on developing either in-house capacity or actually about working in partnership with other software developers working to a commission provided by NWIS. And I think it's a very sensible conversation to engage in and take forward. On your point about how long the trials will run on the new models for care, I'm not in a position to answer that. I don't even know what the new models of care are yet. I definitely haven't seen an advanced copy of the report for 5 or 6 months' time, but I can assure you of that. But when that is provided, we'll then have a sense from the panel itself about at what point in time they might advise us that we would need to wait to then have enough evidence to look for system-wide change in the way in which we deliver services. So we'll all have to wait a few more months to see what the trials will look like, let alone how long they will then run for. And in the point about engaging the public, again, this has been mentioned by previous speakers too, and I certainly recognise that we need to consider how we do that deliberately and specifically. I think calling for the public and encouraging the public to engage is one thing, not just about what we've done today, but in future engagement as well. I don't think anyone seriously expects me to knock every door in the country, asking people to respond to the parliamentary review. Some people might not want to see them on their doorstep, frankly. But there is that broader point about all the different actors around our health and social care system and how they are partner wanting people to engage as well in the third sector, have a large reach potentially into their own supporter and engagement networks in ways that other organisations don't, and they could be really important in getting the public to genuinely engage, debate and discuss these ideas. And the final thing I'll say is that whilst I don't quite agree with your analogy to Darwinism and whether people change will just happen to us or will wither away, the point about this is we have a choice to make. Unlike people where change happens to you and that evolutionary process, we have a real choice to make about how we choose to change our system or whether we sit back and allow change to happen to us. And I absolutely believe that we should choose what to do with our future whilst we have the ability to do so and not wait for someone else to make that change for us.
Thank you.